Many people are putting off doctor's appointments, even emergency care during the pandemic. Nancy Chen reports on how that could lead to deadly consequences.
Will Fontaine had been feeling tired and having chest pain for months, but the Florida grandfather says he was worried about being exposed to COVID-19, so he delayed seeing a doctor. When he finally made an appointment,
I had 100% blockage in one of my arteries and 80 and 70% in two of the other arteries.
Tests showed he could have had a heart attack at any moment and that he needed triple bypass surgery.
Do you think you would be here today without that surgery?
Feeling as good as I do now and how bad I felt before, I'm not so sure that I would still be alive.
A survey from the Orlando Health Heart and Vascular Institute shows 67% of Americans are concerned about going to medical appointments when coronavirus rates are high.
There's still significant reservation in patient groups with regard to seeking medical care.
Nearly 3 in 5 are hesitant to go to the hospital for an emergency. Cardiothoracic surgeon Dr. Stephen Hoff worries that could have deadly consequences.
We believe it's very safe to come to a medical institution. Delays in diagnosis and treatment lead to bad outcomes.
Fontaine is glad he finally got the care he needed.
Getting back to playing with the grandkids and wearing them out instead of them wearing me out at the end of the day.
He urges others not to put off their health like he did. Nancy Chen, CBS News, New York.
Doctors say telehealth can also be a good initial option for patients to check in with their healthcare providers. A new study is shedding light on the toll the pandemic is having on the mental health of people working in the ICU. British researchers surveyed more than 700 healthcare workers from 9 ICUs in England over the summer. Nearly half reported poor mental health. That includes PTSD or problems with drinking. In the past 2 weeks, 13% reported frequent thoughts of hurting themselves or being better off dead.